Hello, everyone. My name is Vieri Beretti, and I'm pleased to be your host for tonight's Ask the Experts town hall about COVID-19 Omicron, children's vaccines, and holiday guidance. We'll hear from our panel of public health and medical professionals shortly. After that, it will be your turn. You can get in line to ask a question at any time by pressing *3 on your phone keypad. You'll be put through to an operator who will ask your name and question and put you into line. Please try to keep your questions as brief as possible. Online listeners, you can also ask questions. On Corpus Christi's Facebook and YouTube pages, you will see a link to the online question queue. We'll also be asking you a few questions in the form of quick polls. Please use your phone keypad to respond. Online listeners, please follow the link provided. You can also provide feedback by leaving us a voicemail by staying on the phone after the town hall ends. If you're ready to make an appointment to get your vaccine, you can press *0 at any time before 7:15 p.m. tonight. At this time, I'd like to introduce our panelists. From Corpus Christi, Nueces County Public Health District, we have with us Director Annette Rodriguez, Assistant Director Luis Wilmot, Public Health Emergency Preparedness Manager Dr. Moriam Ojalade, and Epidemiologist and Public Health Administrator Denzel Otokunran. I'm also pleased to introduce Dr. Kim Onyufrak, Clinical Director and Alternate Local Health Authority of Nueces County, and Dr. Jaime Fergie, Director of Infectious Disease at Driscoll Children's Hospital. Thank you for being here. Now let me introduce Annette Rodriguez, Director of Public Health. Annette, can you give us an update on COVID-19 in Corpus Christi and Nueces County?
Thank you, Vieri. Yes, absolutely. So welcome everybody to the town hall meeting. I'm so glad that you could join us tonight. And just a little bit of update of where we are with COVID-19 in our community. So we continue to stay fairly steady. You know, we've been running around in the mid-30s for the number of cases per day. We were a little over 40 today. We believe that Omicron is already in our community, but we believe that people are doing the right thing. They're actually staying home when they're sick, and they're protecting themselves, and they're keeping themselves isolated to keep other people safe. So we really appreciate that. But we also know that there's a lot of travel currently because this is the week of Christmas. We continue to monitor those numbers very carefully. We know that we're only, for the whole community, we're only at 54% vaccinated. And so that rate is still low, and it still needs to, to get better. And so we want to encourage you, if you have questions, tonight is the night. Ask your questions because we really want to be able to answer those questions. We have doctors on our panel, and so we're very excited to be able to give you as much information as you need to make the right decision for you and your family members. So with that, I want to say thank you again, and I want to turn it back over to Vieri.
Thank you, Annette. For those of you just joining tonight's Ask the Experts town hall, we're discussing COVID-19 Omicron, children's vaccines, and holiday guidance. To ask a question live on air, please press *3 on your phone keypad now, or follow the link to the online question queue. In addition, you can leave Public Health a voicemail by staying on your phone after the town hall ends. As well, if you're ready to book your vaccination appointment right now, you can press *0 on your phone keypad at any time to be connected with a booking agent. Along with answering your important questions, we'd like to ask you some questions in the form of quick polls. So let's do one right now. I'm going to read out a question and 5 answers. Please use your phone keypad or follow the link in social media on your social media platform that you're watching to select your answer. So our first poll question is, to help us understand who is on the town hall tonight, we'd like to know what your age range is. Press 1 if you are 18 to 25. Press 2 if you are 26 to 35. Press 3 if you are 36 to 49. Press 4 if you are 50 to 65. And press 5 if you are over 65. And I'll repeat that question to help us understand who is on the town hall tonight. We'd like to know what your age range is. Press 1 if you are 18 to 25, 2 if you are 26 to 35, press 3 if you are 36 to 49, and press 4 if you are 50 to 65, and finally, press 5 if you are over 65. Thank you. Thank you so much for participating in the poll. Tonight, Corpus Christi Nueces County Public Health District is talking about COVID-19 Omicron, children's vaccines, and holiday guidance. And if you have a question for our speakers, please press *3 now on your phone to get in line to ask your question. So it looks like we do have a few people in line. So let's get to our first question of the night. Online, we have Vera. And Vera, you are live. Please go ahead with your question.
Yes, my husband and I both have had COVID. January and going into February, we were in the hospital, but not under a machine or anything. People keep talking about this natural immunity. I realized we had it when we came out of the hospital for a while, but how long does natural immunity last?
Thank you for that question, Vera. And I will ask Dr. Onufrak to answer that question. Doctor?
So that varies for each individual person. What we know is that you can get reinfected again if you are not vaccinated. So that's the main message, especially right now with Omicron in the air. It is actually, you are 3 times more likely to get reinfected than Delta if you are not vaccinated. So really the biggest thing right now is if you're not vaccinated is to get vaccinated, because it really is unknown. You still can get reinfection again, you know, especially right now with Omicron. You're 3 times more likely to get, it's more infectious than Delta. So, you know, even though you have the infection right now, you should still be vaccinated.
Thank you for that answer. And thank you, Vera, for your important question. Let's go to another quick poll really, really fast. I'm going to ask a question and read out 4 answers. Please select your answer by pressing the number on your phone keypad. Online listeners, look for the link in the YouTube or Facebook posts. Please listen to all the answers before you make your selection. So our next question is, for those of you with children in your household, press 1 for my children are vaccinated against COVID-19. Press 2 for my children are not vaccinated against COVID-19. Press 3 for I need more information before getting my children vaccinated. And press 4 for I will not get my children vaccinated. And I'll repeat that question. Our second question of the night is, for those with children in your household, press 1 for my children are vaccinated against COVID-19. Press 2 for my children are not vaccinated against COVID-19. Press 3 for I need more information before getting my children vaccinated. And press 4 for I will not get my children vaccinated. And thank you again for participating in our poll. And a quick reminder, press *3 right now to get into line to ask your important question. So let's move right to our next participant. And then our next participant is Dolores. Dolores, you are live. Please go ahead with your question.
Yes, I was vaccinated in July and August. Before my last shot, I ended up catching COVID a week into it, and I would like to know, will I still need to get a booster, or am I covered?
Thank you, Dolores. That's an excellent question. And I'll ask Dr. Onjalade if she'd like to respond first, and then we'll go to Dr. Fergie.
Yes, thank you for your question. So since you got fully vaccinated in August, the CDC does recommend that you get a booster shot because over time, the initial vaccination wanes. It's not totally gone, but it wanes. And so to boost your immunity, after 6 months, if you got either Pfizer or Moderna, you're recommended to get a booster shot. Now, if you got the Johnson & Johnson vaccine, you're recommended to get a booster shot at least after 2 months. And this is to boost your immunity, especially with the Omicron variant that is circulating. They're seeing a lot more reinfections. So despite the fact that you are fully vaccinated and also got COVID, after that 6 months, you are recommended to get the booster shot.
Thank you, Dr. Ojalade. Dr. Rodriguez, or sorry, Dr. Fergie, would you like to also add to that?
I fully agree with that answer. And first of all, I can sense the frustration of having done the right thing. You were fully vaccinated, still you got the illness. Still, I think the issue is that you're probably better off with the vaccine. And I'm sorry it didn't protect you fully, but it should at least offer you some protection. But I really fully agree with the previous answer. It is the best thing for you to be boosted with another dose at the right time, because now we have a different variant, and it will help you. So keep doing the right thing, and I'm sure it will help you. Again, if not fully, at least it will protect you from severe infection.
Thank you for that answer, and thank you, Dolores, for your important question. We'll go right away to our third poll question of the evening. Our third poll question is, are you concerned about COVID-19 Omicron? Press 1 for yes, it spreads more easily than the Delta variant. Press 2 for yes, it can cause severe illness like the Delta variant. Press 3 for yes, I don't have a booster yet. Press 4 for all of the above. Press 5 for none of the above. And finally, press 6 for no, I am not concerned about COVID-19 Omicron. And I'll repeat that question. Are you concerned about COVID-19 Omicron? Press 1 for yes, it spreads more easily than the Delta variant. Press 2 for yes, it can cause severe illness like the Delta variant. Press 3 for yes, I don't have a booster yet. Press 4 for all of the above. Press 5 for none of the above. Press 6 for no, I am not concerned about COVID-19 Omicron. And thank you again for participating in our poll. And I'll remind everyone listening that if you have a question that you'd like to ask our panelists, press *3 now to get into line. Let's go to our next participant. And our next participant is Sherry. And Sherry has asked that we read her question. Her question is, I want to know, since my whole house is vaccinated and my 6-year-old has taken 2 shots and had open heart surgery and other conditions, will she be able to have a booster? So Dr. Fergie, if we could go to you, and then we'll go to Luis.
Well, first of all, congratulations on being vaccinated and having your son, your 6-year-old, vaccinated. It's really important, and I want to encourage everybody to have their children vaccinated 5 years of age and above. So great. I mean, you're all protected at home. That's wonderful. Be sure everybody who can be boosted is boosted, but unfortunately, 6-year-old at this time cannot be boosted. So the third dose or the boosting dose is beginning at 16 years of age. Hopefully, with everything you have done, you should be all right. Thanks.
Luis?
Yes, I just want to piggyback on what Dr. Fergie just said. So yeah, Pfizer has been approved for booster shots ages 16 and above now. Until we are still pending more CDC guidance as the studies are coming out, whether younger people will be required to get a booster. In the meantime, great job on vaccinating the whole family. The child's been vaccinated. The other things, let's not forget the kind of the basics and the fundamentals we've been preaching the whole time. There's things you can do at home to help decrease your risks, such as frequent hand washing. Often kids, they grab some bag of chips and start, licking their fingers and such. Make sure that they're washing their hands, they're sanitizing their hands before touching their face or eating. Make sure that they're wearing masks if they're in congregate settings. With your son's conditions, they should be wearing masks when they're out and about, period. That's what I would do for my child. So just continue doing those basic fundamentals that have prevented people from getting sick in the first place. And once boosters are approved for your child, your public health district will be sure to offer them accordingly. Thank you.
Thank you, Luis, and thank you, Dr. Fergie, for your responses, and thank you, Sherry, for your important question. So now we have our last poll question for you tonight. Again, please use your phone keypad to select your answer. YouTube and Facebook viewers, please follow the link to the poll page. So our last question of the night, our last poll question of the night is, what is your vaccination status? Press 1 for I have both vaccinations. Press 2 for I have one vaccination. Press 3 for I am planning to get vaccinated. Press 4 for I am not planning to get vaccinated. And press 5 for I prefer not to say. And I'll repeat that question. What is your vaccination status? Press 1 for I have both vaccinations. Press 2 for I have one vaccination. Press 3 for I am planning to get vaccinated. Press 4 for I'm not planning to get vaccinated. And press 5 for I prefer not to say. And thank you once again for participating in our polls. And don't forget, press *3 to get in line to ask your questions. And if you're ready to book an appointment to get vaccinated, press *0 right now to be connected with the vaccine line. Let's get to our next participant. Our next participant is Menda. I hope I'm pronouncing that correctly. Menda has asked me to read the question. And the question is, how many boosters are we likely to end up receiving? How many boosters are we likely to end up receiving? And Denzel, I'll let you take that one.
So Menda, in regards to your question about how many boosters we're likely ending up to receive, that really is going to depend, on the way this pandemic is going down, is projecting in the future. So as you saw with the boosters we've been receiving from Moderna, Pfizer, and Johnson & Johnson, that has been dependent upon, the waning of the vaccines due to, the Delta variant and other mutations that occur as viruses do mutate. So it really is going to depend on how the virus mutates down the line and how it's going to act. And so that's the best way to answer your question, Menda.
Thank you, Denzel. Let's go right to our next participant who is live. Our next participant is Fung. I hope I'm pronouncing that correctly. Fung, you're live. Please go ahead with your question.
Yes. My biggest question is how people are saying that the virus is mutating because a lot of people aren't getting vaccinated, but at the same time, the people that are vaccinated are still getting it. What if everyone were to get vaccinated, would it finally put an end to this, or would this continue to mutate and we don't know what's going to happen next?
Thank you for your excellent question. Dr. Fergie, would you like to take that?
Yes, I tell you, we do want everybody to be vaccinated for very good reasons. Obviously, the protection of the person, the protection of the family, the protection of the community. People who are vaccinated, of course, have tremendous advantage in terms of decreasing the chance that they're going to get the illness. And even if they get it, and they could just get some, upper respiratory symptoms, very unlikely are going to end up in the hospital or dying with it. Not impossible, obviously, not impossible, nothing like 100%, but your chances are so much better if you're vaccinated. So do not hesitate. You have been vaccinated, that improves your chances quite a bit. Ideally, if we get everybody vaccinated right now, if we could, then that would immediately limit the potential for development of mutants or variants, the same thing, yeah. And the problem we have is like some of these variants come from parts of the world where few people are vaccinated. Not to say we haven't had some variants originating in the United States. Fortunately, some of those did not pan out to be as easily transmittable as the ones that came from England or South Africa. But it will make a tremendous difference if we can get the world vaccinated. Obviously, 100% is very difficult, but the more people vaccinated, less likely you're going to have variants, and therefore that is the way. If we avoid variants, people vaccinated will be able to get out of this situation. So let my colleagues add to that.
Thank you, Dr. Fergie. Annette?
Yes, I just wanted to add on to that. So if the virus is never allowed to replicate or to transmit from one person to another, then we're all safer, because when it replicates from person to person and you see a lot of transmission, that's when the variants, like Dr. Fergie said, that's when the variants originate. And then they change. It's kind of like when they're duplicating, sometimes they make a mistake. And when they make a mistake, sometimes they become stronger or more transmissible, and then we have a bigger problem. So you're exactly correct. The more people that get vaccinated, and now the boosters, because we have found that after 6 months after your second vaccine, or 2 months or more after your J&J, the vaccine starts to wane. So you start losing that protection that you originally had with the 2 or the 1 J&J. So it's very, very important. And I'm glad you brought that up, because I hope the whole community hears that it's very important, but it's not only for us in Nueces County. This is global, like Dr. Fergie said. So we all have to get vaccinated, not at 100%. But anything that's closer to where we're all at is going to make us safer. And so that's really why we keep talking about not only getting your 2 vaccines, but at 6 months after your second mRNA, to please get your booster to stay protected. Thank you.
Denzel?
I just wanted to add on to what Annette said as well. There's a thing called herd immunity. So essentially, the higher a vaccination rate, the less likely you're going to have that virus jump around from person to person. Most likely, which also means that less likely for that virus to mutate. And so it's like I want to add on to what Annette and Dr. Fergie say. Getting vaccinated is very important, especially to prevent severe disease as well as hospitalization and overwhelming our healthcare system.
Thank you, panelists, for that answer to that very important question. Our next caller is Cynthia. Cynthia, you're live. Please go ahead with your question.
Yes, I was just curious about, I had been told before that we had the Johnson & Johnson, the one-time vaccination, that we were not going to need a booster. So has it changed now? Do I still need a booster? I took the Johnson & Johnson back in May.
Thank you, Cynthia. Dr. Onufrak, would you like to take that question?
Yes, so the guidelines currently are, if you receive the Johnson & Johnson, you're recommended to get a booster if you're 18 and up 2 months after your dose. So since you were vaccinated back in May, you should go get your booster now. And you can choose from all 3. Currently, the recommendations are to either get Moderna or Pfizer, because that would be better.
Thank you for that answer, Doctor. And thank you, Cynthia, for your question. Our next live participant is Pragati. I hope I'm pronouncing that correctly. Pragati, you're live. Please go ahead with your question.
Hi, everyone. My question is, among the people who are fully vaccinated, they've had their both vaccine and also a booster shot. I'm trying to see that this population may be of two kinds, one that are more vulnerable, and the other who are otherwise don't have any preconditions. And I'm wondering which ones are reaching hospitalization frequently and for what severity of symptoms are they experiencing?
Thank you very much for your question, Dr. Onufrak.
So for what I have seen, the ones that have been vaccinated and boosted, the ones that have come in, their symptoms are very mild. They sometimes say that they didn't even realize they had COVID. They only realized it when they heard, a family member or a coworker were positive, and then they decided to get tested. So if you're vaccinated and you're boosted, sometimes you're asymptomatic, or you could have very mild, cold, sinus-like symptoms. The ones that are in the hospital, their symptoms are a little more severe. So you actually have to meet admission criteria, whether, if you have to require oxygenation or some kind of oxygen support. So a lot of times if you're immunocompromised, then your body might be able to fight off the infection as well. You might need a little bit of help with some IV fluids if you're dehydrated, or some oxygen if you're having a hard time breathing. So those are the only times that we really admit anybody, is if they require any kind of support by the hospital. But if you're vaccinated and boosted, the majority of those are not hospitalized. The ones that are usually hospitalized are the ones that are unvaccinated.
Thank you for that answer, Doctor. And let's move on to our next participant, which again is a live question. And it's coming from Jared. Jared, you're live. Please go ahead with your question for the panelists.
Yes, this is Gerard.
Oh, Gerard.
I want to know if can you hear me?
Oh, we can.
Can you hear me?
We can hear you.
If the Omicron is airborne, because people refuse to wear masks, I would think it's airborne. I always think a virus is airborne. It doesn't matter, because when you sneeze, it gets into the air. Am I correct?
Dr. Onufrak, would you like to take that question?
Yes. So especially with Omicron, it has been shown to be a respiratory airborne illness. That's the recommendation right now, is even though you're vaccinated, if you're going to go to a public indoor place, that you should be masked, because it is a respiratory viral illness right now, and it is being spread faster that way.
And Annette, would you like to also add to that?
I was just going to concur with Dr. Onufrak that it is considered airborne. There are other mechanisms that you can actually pick up the virus as well, but the main mode of transmission is through the air. And so that's why you do wear the mask, and you also social distance from one another to try to keep that distance, so that if somebody is speaking or singing or coughing or sneezing, that you don't get those airborne droplets into your system. Thank you.
Thank you, Annette. And thank you, Gerard, for your question. Our next caller is Marcus. Marcus has a live question. Marcus, you're live. Please go ahead with your question for the panel.
Yes, sir. I was asking, I believe one of your questionnaires to another person, I believe, answered my question. I had the J&J one time, and then I had the booster in August. And I was just concerned because of I take care of my parents here at their house. They're 82 and 80. And do you believe that I need to take another booster, being that I was told that it was a one-time shot from J&J, or was I told a false
Thank you for your question. Dr. Onufrak, would you like to take that as well?
Yes, so the recommendation by the CDC is that if you receive Johnson & Johnson, you should get a booster dose 2 months after your vaccination. So I'm not sure when you received your J&J first dose or only dose, but if it's been 2 months or more, you should get your booster dose. And the same thing with your parents. If you are taking care of your parents, if they're not boosted yet, and depending on what vaccine they got, if they received Moderna or Pfizer, they should get their booster dose 6 months after. If they receive Johnson & Johnson, they should also get a vaccine dose. And with your booster dose, you can get any 3. You can decide which one you want. And if you're going, you don't have to go through the VA. We also have several sites that are available. We have the mall. And if your parents, they're not able to walk into the mall, what you can do is you can go in and ask one of our medics or our nurses to come out and vaccinate your parents for you as well, so they don't have to travel inside. So if you're having a hard time getting into the VA or getting into your provider or anywhere else, we do have other sites. We have the mall, we have Robstown Clinic, it's at the Nike store, we have Greenwood Senior Center, we have City Hall Courthouse that's available. We also have Physicians West. So we have several sites that are available. You do not require an appointment. You can just walk in, and all you have to do, if you didn't get a vaccine with us before, you just have to register again, and then we'll get your booster dose, and then you're out the door within 15 minutes.
Thank you, Doctor. Our next caller is Tony. Tony, you're live. Go ahead with your question for the panel.
Hi, can you hear me?
We sure can.
Okay, my question is simple. I'd like to get the booster shot, although I currently have a cold, and I don't know, should I wait till my cold's over, or can I just go get one now?
Denzel, would you like to take that?
Yes. So I am recommending to you, sir, that first I would recommend getting tested just to make sure it's a cold. Once you are done with that, I would recommend you follow the procedure. You stay at home until you feel better. That's if you test negative for COVID-19. Now, if you do, that's when you quarantine for at least 10 days, 10 to 14 days, just to ensure that you're not spreading it towards others. Per CDC guidance, the most important, the reason why you don't want to go when you're sick is you don't want to get other people sick. People who are going to be giving you the shots. But once you feel way better and once you ensure that you're COVID-19 negative, you can come and get your shot.
Thank you, Denzel. Our next question comes from Sherman, who'd like to ask live. Sherman, you're live. Go ahead with your question for the panel.
Yes, good evening. I've taken a Moderna shot, and I've also been boosted. But my question is just a general question. Do you have to wait 6 months to get a booster shot, or can you get the booster shot earlier than 6 months? I just want to know so I can inform my friends and family. Thank you.
Thank you, Sherman. Dr. Ojalade, would you like to take that question?
Yes. So according to CDC recommendations, the booster shot for the Moderna or any other mRNA vaccine has to be taken after 6 months after the initial complete dose. So the only time that you get less than 6 months is if you had the Johnson & Johnson vaccine instead. So that is the current CDC recommendation.
Thank you, Doctor. Our next question comes from Samuel. Samuel, you're live. Go ahead with your question, please.
Yes, thank you very much. The question I have is related to the efficacy of the vaccines. And the question I have is, if the vaccines are so effective, then why is it that there's been more deaths this year with the vaccines than there has been last year without the vaccines? And why is it the continuous reason to continuously have these boosters and things of that nature?
Thank you for your question, Samuel. Dr. Onufrak, would you like to take that?
Samuel, that's a very good question. So the majority of the deaths, even though we had the vaccine, were in the unvaccinated. Okay. So this is a pandemic of the unvaccinated. So the people that were surviving this pandemic currently are the ones that are vaccinated. So unfortunately, it was with Delta, it actually hit the younger people, which in the beginning felt like they didn't need to be vaccinated. We had the majority of our folks that were older, that were immunocompromised, that had high comorbidities, they were vaccinated first. And they actually survived the second wave because they were all vaccinated. The younger people, so with their second wave, we did have more deaths. But also, if you look at it, they were younger and they were unvaccinated. And so that was the unfortunate thing. Two parts to the question on why we need boosters. So first part, we need boosters is because the studies show that after 6 months, our immunity wanes a little bit. So we have to boost our immune system. But then the other thing too is, especially with Omicron, is that with our 2 doses that we have with our vaccination, it's not as effective. It's only about 40% effective. So we need to get that booster dose to get it up to 80% effectiveness.
Thank you, Doctor, for that answer. And Samuel, thank you so much for your important question. Our next question comes to us from Bob, who has joined us online. So I'll read his question. And Bob's question is, why aren't you discussing natural immunity? Why aren't you discussing natural immunity? Who would like to take that question? Dr. Fergie?
Well, we certainly talk a lot about natural immunity, and we know a lot more about natural immunity now than we knew at the beginning of the pandemic. And we certainly know it's not as good as we thought it was going to be. So it is clear natural immunity wanes with time, a few months, and you lose it. Also with the variants, natural immunity is not that great. So yeah, it helps a little bit. There's no question about that. It's, if you were sick before, you have a little bit of protection, but it's not like with other viruses and like, you got it one time and you don't get it again in your life. These coronaviruses, all coronaviruses actually are like this. You can get it multiple times. Natural immunity is not that great. It's not that we don't believe that natural immunity exists. It does exist, but it's not great. It's not good. And we know that people who have not the infection, meaning natural immunity, and get vaccinated are much better protection, in great shape. But let me say one more thing, and that is, we're all frustrated. And I feel the frustration in the audience and the people who listen to us. It is real. And we're going through it for over 2 years. Well, not yet, but almost. It feels a really long time. And we learn more, we change guidance, and people think, why did we change? Well, we changed because we didn't know before, and now we're learning more. So I want people who ask, for example, the 6-month question for the booster, don't be surprised. Don't think that we're not telling you the right thing right now. Is that it may change. It may be that CDC and the scientists are working on this may say later on, hey, it's going to be 3 months, it's going to be 4 months. So we're telling you the best that we know right now. But we're on this together, and I feel your frustration. I am frustrated too. Thank you.
Thank you, Doctor. Luis, would you like to add to that answer?
Yeah, just to add a little bit, as far as history is concerned, if you go back to looking at the Spanish flu or the 1819 influenza pandemic, we didn't have vaccines for flu at that time. So we were depending on natural immunity to help us, and we lost a tremendous amount of people during that pandemic. That pandemic. So, I hear you that you can eventually build some immune system, but we're trying not to lose as many people as that pandemic that we went through back then, because we have the vaccines now that can help, and we do believe they're making a difference. We see it in the numbers. We see it in the people hospitalized. The people are hospitalized are usually the unvaccinated. The numbers don't lie. So if you look at that back natural immunity that we depended on back in the great pandemic of the flu pandemic, we lost too many people, and we're not planning on losing that many people this time around.
Thank you, Luis. And Bob, thank you for your question. I'll just take a moment to remind all of our listeners that if you have a question for the panel, please press *3 now on your phone keypad to get in line, to talk to an operator to ask your question. And if you are ready to book your vaccination, just press *0 on your phone and you'll be put through to an agent who will help you get booked for your vaccination. Our next question comes to us from Judith, who is live. Judith, you're live now. Please go ahead with your question for the panel.
Yes, thank you. A family gathering here at Christmas time of about 9 people, all who have been vaccinated and boosted, except one of them has refused vaccination. Included in that little group are 2 children and 3 immunosuppressed adults. What, if any, advice can you give this group of people who will be visiting in a small home, eating a meal together with someone who has never been vaccinated?
Thank you for that important question, Judith. First, we'll go to Dr. Onufrak to answer. Doctor.
Yes, Judith. So that's a very good question. So one of the things you can do is, if maybe not invite them over, but if you feel like they should come, you want them over, then they should be tested. That's one of the recommendations right now, is to test at least 24 hours before the party or before coming over to make sure that they are negative, that they do not have COVID before coming over and exposing the rest of the family members that did follow guidelines and did everything. The other thing that you can do, weather permitting, is either eating outside. If you can't eat outside, then open lots of windows, have lots of ventilation. Also the sitting arrangements, if it's a small house, maybe try to have it outside or on the patio, but try not to have everybody so enclosed and sitting close to one another. Make sure that they're not sick before they come over. So all of those are important before you get somebody. But I would probably, if you want them to come over, is to advise them to get a test. They do, CVS sells tests that are over the counter that they can get, that they can take prior to coming over.
Thank you, Doctor, for your excellent advice. And Annette, would you like to add to that?
Yes, I just wanted to add that if you have individuals that are immunocompromised, this would be a good year to also consider allowing them to join virtually. And I know, we've been through this for the last almost 2 years, like Dr. Fergie said, but being immunocompromised, even if they're fully vaccinated, we do know that Omicron we're starting to see, vaccine breakthrough cases with individuals that are immune compromised. And we really know that you want to keep your family members safe as well. So maybe consider not inviting them to this event, because like you said, you have children that are probably not vaccinated yet, and one individual that's not vaccinated as well. So at least have that conversation with those individuals.
Thank you, Annette. And Judith, thank you for your question. Our next question comes to us online, and it's from Tanya. So I'll read out the question. Do you know when children's boosters will be available? My 14-year-old took her second shot over 6 months ago. I'll repeat the question. Do you know when children's boosters will be available? My 14-year-old took her second shot over 6 months ago. And Luis, I'll let you take that question.
Unfortunately, the easy answer for that right now is no, we do not know. Okay. However, the CDC is, they are doing further testing and further research to see if it is indicated for a 14-year-old to eventually get a booster shot. They did, like I said, they did recently, Pfizer was approved for, boosters were approved for 16-year-olds and 17-year-olds, where previously they weren't. So there's still some in the mix, but there is not a definite date of when they're going to be approved.
Thank you for that information, Luis. Our next caller is Elaine. Elaine, you're live. Please go ahead with your question.
Thank you. So my question is, since we're getting like I have to take my second COVID shot, like within the next couple of weeks. I don't remember the exact date, but I also get the flu shot every year. So should I don't know if they would notify me, wherever I get at the Walgreens where I'm going to get my second shot. But, is there a certain time frame of when I should wait before I get my flu shot? Or do I not have to get the flu shot because I'm getting the COVID shot? Or, what is the time frame in between the vaccines that I should wait?
Thank you for your question. Annette, I'll let you start with that one.
So that's a great question. And what we've seen today, we had a call with the state and they're telling us that we're seeing more influenza-like illness throughout the state of Texas, which means that we do have to beware that we may pick up flu. Last year, we didn't see a lot of flu activity. So that's a great question. And you can actually get your flu shot the same day that you get your COVID vaccine. And so there is no waiting in between. If you want, what I did was I got my flu shot and then I waited a week. I felt fine and then I got my COVID. But again, you can get them both on the same day.
Thank you, Dr. Ojolade. If you'd like to add to that.
Yes, just to piggyback on what Annette mentioned, really the projection is that we will have a more active flu season. And considering that the Omicron is taking off, the chances of flu and COVID competing for hospitalization for our beds is higher. So really, in addition to your COVID vaccine, we are recommending that you get your flu shot as well to protect yourself during the flu season, and now that we are having a more transmissible COVID variant.
Thank you, Doctor. Dr. Onufrak, would you like to add to that? Oh, Dr. Onufrak, you're muted.
Apologize. So we did see less flu last year, but that's because more people were masking. We have less people masking this year. You still need a flu and a COVID shot because the flu vaccine is specific to prevent you from getting the flu, and the COVID vaccine is specific for preventing you from getting COVID. So you still need to get both vaccines just to prevent from getting flu and also to prevent from getting COVID. So you can't interchange them. You can't get your COVID vaccine and hope that you don't get the flu. So it's specific. So you still need both. And this year we are seeing a rise just because more people are not masked and not following the guidelines and protocol.
Thank you, Dr. And Elaine, thank you for your question. Our next caller is Linda, and Linda is live. Linda, please go ahead with your question for the panel.
My roommate is 73 years old and received one COVID vaccine. She then became ill with RSV virus and bronchitis. Her COVID vaccine was over 6 months ago. Do we need to start her all over again or just continue the vaccines and then the booster once she's well?
Thank you, Linda. Dr. Onufrak?
So currently the guidelines are to just not to restart the series. So she would just get her second dose and then she would wait 6 months to get her booster. Now, if she has any immunocompromised conditions, then you just wait 28 days and then she can get an immunocompromised dose or a third dose.
Thank you. And thank you, Linda, for your question. Our next question is an online question from Andra. And the question is, why is the public health district only pushing vaccines and not informing the public of effective early treatment protocols? I'll repeat the question. Why is the public health district only pushing vaccines and not informing the public of effective early treatment protocols? Luis, would you like to take that question?
Yes. So thank you for the question. Your public health district has a three-pronged approach to the COVID. First of all is prevention, right? So that's where we're telling you folks, mask up, be cognizant about your congregate settings, wash your hands, etc. Part of that prevention is also vaccinations to give people the best fighting chance against this virus. And we are offering early treatment protocols in the form of monoclonal antibody infusions. So there is some evidence that these monoclonal antibody infusion give people the additional boost they need to fight the virus. We had a RIC, we called it RIC, where we help infuse, I should say, over 3,200 people. And we believe we kept a lot of those folks out of the hospital. We also had a state asset. Texas brought an asset here to Richard Borchard Fairgrounds, and they also provided that type of treatment, which also helped keep a lot of folks out of the hospital. Other treatment protocols, I'm not sure what you're referring to. There's a lot of stuff online, misinformation. Just know that we practice evidence-based medicine. There is some evidence that these current monoclonal antibodies are effective for early treatment of COVID-19. There is not evidence of other drugs, such as the ones that you probably heard online, and I don't even want to repeat them on here because that's not an approved evidence-based medicine. So we do offer treatment in the form of monoclonal antibody therapy.
Thank you, Luis, for that important information. Our next caller is Suzanne. Suzanne, you're live. Please go ahead with your question.
My question, I believe, is twofold. The first part is we saw a lot with what I would call original COVID-19, and then we've seen a lot with the Delta variant. Now we're on the Omicron variant. And what I am looking for is, are the symptoms and signs from the previous two going to be the same, or are they different? And then once someone is diagnosed, those over-the-counter testing and or the physician testing, do they know whether they are Delta variant positive, or is there an assumption that all the positives are going to be the Omicron variant? And then when that positive comes across, does the infected person stay home from work 3 days, 5 days, or is it similar to the Delta variant and the original COVID-19 where they were asked by CDC to stay away for 10 to 14 days? Sorry, my question is so big, but it's twofold.
Thank you, Suzanne, for your question, and I'll ask Dr. Onufrak to answer it.
So with whether it's an alpha, delta, Omicron, it's a respiratory viral illness. And most of your viral illnesses are going to have similar symptoms. You can have fevers, chills, body aches, cough, congestion. One of the sticking points last time was loss of taste or smell. Not everybody's going to get loss of taste or smell. You might have some, nausea, vomiting, diarrhea. It's just if you are ill, especially right now, one of the first things you should do is get tested for COVID. That should be highest on the differential right now, is to get tested for COVID, get tested for flu. If you have a sore throat, add, strep throat also on there. We're also seeing RSV. Used to be only in children. Now we're also seeing it in adults. So just because you're COVID negative, maybe you tested too early, we do need to, it's all different kinds. If you feel sick, that should be, it doesn't matter what your symptoms are, it should be, you should test for COVID. Now the tests do not automatically tell you if it's alpha, delta, Omicron. We have to send it out for sequencing in order to tell if it is. Currently, we do not have it here in Corpus, but it's just a matter of time before it's here. The majority of the variant right now still is going to be Delta, but with Omicron getting higher and higher, now we can't positively say, whereas before with our last surge, we were able to say, yes, this most likely is Delta, since 99% of it, testing was Delta. Now that it's higher with Omicron, we really can't tell, but some of our PCR testing, you can have an idea whether or not it is Delta. or Omicron, but those over-the-counter tests, it just tells you if you have a possibility of having COVID or not. Same thing with our PCR. We really have to send it out for genetic testing to be sure.
Thank you, Doctor. Annette, did you want to add to that?
Yes, I was just going to add, and that's a great question. You know, with the original, it was really more of a lower respiratory infection. So people were really struggling to breathe. And then with the Delta, it was more of an upper respiratory, and there was a lot of loss of taste, of smell and taste. With this one, what we're hearing from South Africa is that they don't really see a lot of loss of taste and smell, but it is still upper respiratory. And that's one of the reasons why they're saying it's so transmissible, like Delta. So that's a great question, but I just wanted to clarify those for the symptoms. Is it probably for this, what we're looking at, again, it's very early. We didn't see our first positive Omicron until November 11th from Botswana. And so it's still very, very early, but it looks like it's mostly upper respiratory with sore throat and cough, all of those things that could be typical of an influenza-like illness. And so again, like Dr. Onifrak said, you really should go and get tested to make sure that, you know, maybe you don't have COVID-19, maybe you have the flu or a respiratory syncytial virus or something else.
Dr. Onifrak, did you want to add to that?
Yes, so I forgot to answer the second part of the question about the isolation. So if you are positive for COVID, then you do need to self-isolate and quarantine for 10 to 14 days. Okay, so that hasn't changed. You know, originally it was 14 and then CDC guidelines currently say 10, but just to be sure, you know, I don't think it would hurt to just add that extra few days. So we do recommend, if you are positive, you should self-isolate, quarantine, monitor for symptoms for 10 to 14 days.
Thank you, Doctor. And we have one more caller to go. It's been a great event with lots of great questions, but unfortunately we've run out of time, but we can get one more question in here. And that question is a live question from Mary. Mary, you're live. Please go ahead with your question for the panel.
Oh, my question is, I survived with a vaccine of the swine flu in 1976. Also, I've had some symptoms of, I don't know if they're asymptomatic or not. I don't have any appetite at all for about 3 weeks. That is not a symptom of the I can smell and taste some, but that's not a symptom of the coronavirus, is it?
Thank you, Mary. Dr. Onifrak.
Hi, Mary. If you are having symptoms for over 3 weeks, you really need to get with your physician. You know, call your physician, talk with them. There could be something else that's going on that is not COVID. Okay, so just because you take a COVID test and you are COVID negative, there could be something else going on, especially if you have continued symptoms.
Denzel?
Yeah, just adding on to what Dr. O said as well. You know, the first thing is just making sure you get tested, you know, for COVID-19, get tested for flu, and just see where you, if you haven't already, to see where you're at with that. And then, like Dr. O said, follow up with your primary care physician.
Thank you, Denzel. And Mary, thank you for asking your important question. As I said, it's been a great event with a lot of really important questions. Annette, there have been lots of questions and lots of great responses. What are you hoping that the listeners tonight will do to stay safe in the coming weeks?
Well, you know, we continue to tell everyone that they really need to double down on all of the efforts. It's not just one of anything. It's kind of doing it all simultaneously, if you will. The only way to protect yourself from this virus is to isolate yourself and stay home. And we know that's unrealistic. So when you are going out, that you make sure that you're wearing your mask properly, you're covering your nose and mouth, you're staying away, social distancing as much as possible, you're limiting the amount of time that you're in crowded areas, you're washing your hands as soon as you get back in that car, as soon as you get home, everything that you can possibly do. But we know that the best defense is getting vaccinated, and we know that 6 months after the second mRNA, it's time for a booster. So we hope that today that we were able to answer as many questions as possible to keep that hesitancy from occurring, and that as many people will continue to stay safe in our community. And we appreciate everybody joining us for the town hall meeting, and Converso also for helping us to put this on this evening. Thank you all.
Thank you, Annette. So this does conclude our town hall. Thank you to our panel of public health and medical professionals for being here tonight. If you wish to leave a question or a comment for Corpus Christi Nueces County Public Health District, please remain on the phone after the town hall ends, and you'll be prompted to leave a voicemail. And we wish you all a safe and happy holiday season. Good night.
The Access Live event has ended. You are the